There are biological aspects such as medical treatment and medications that can address suicidal behavior, though there can be controversy surrounding it, as in the underlying psychiatric conditions, things like antidepressants, SSRIs, mood stabilizers like lithium, and antipsychotics like clozapine have shown some effect, but there are also other studies that show that it might not have such a strong effect. Effective treatments or interventions often involve a combination of medication and therapy. Things like cognitive behavioral therapy and dialectical behavioral therapy have shown some evidence that it can reduce self harm and suicidal behavior. Although, from a very Western centric perspective, there are some small studies in Nepal and Malaysia that show preliminary evidence it may work. But again, it's very important to kind of contextualize this in culturally diverse populations. We come then into the social aspect of suicide prevention and what works in terms of interventions. Cash transfers have been shown to work in Brazil, kind of a Islamic country. More work needs to be done. How feasible, how sustainable these are, because we know that things like economic recessions and financial deprivation are very strong suicide risk factors. Policymakers can be actively involved in increasing the social protection and welfare in societies to specifically address suicide prevention. It is so important to be able to, yes, look at evidence based approaches, but also to think of the person in front of us and how those evidence based treatments can be personalized and put the person in the center.